So I'm Dr. Joshua Gluck. I've been at Ventura Orthopedics for 8 years. I do orthopedics sort of globally, but also my subspecialty is shoulder to fingertips. Born and raised in Virginia, grew up there in a relatively small town, like 45 minutes outside of DC. 2 parents and a sister, and a bunch of animals living out in the woods. No TV, no video games for the Glucks. And so just a lot of time to read and play outside and enjoy the outdoors. My dad was the orthopedic surgeon in town, so it was kind of a similar feel where everybody kind of knew everybody. I stayed in state for college, went to University of Virginia, and then I went to Philadelphia to Temple University for medical school. And then I went back to the University of Virginia to do my orthopedic training for 5 years. And then my fellowship was kind of scattered. It was based in New York, where I spent a year at Roosevelt Hospital. But then I also did 3 months in New Zealand as part of my fellowship, doing specializing in hand and wrist. And then I did 3 months in Dallas at a children's hospital doing congenital hand abnormalities in kids. I think high school biology was where I was like, I think of medicine is like this is the stuff that I really like. Orthopedics itself is interesting. I mean, you can fix stuff. It's very sort of mechanical, which I like. And then hand, I just found the most sort of complicated and intricate, which I found interesting. I enjoy fixing things and putting things back together. And so for your shoulder to your fingertips, there's dozens of joints and there's lots of nerves and tendons and things that can be fixed and can be injured and are also obviously super important to people's livelihoods. So. I mean, I'm comfortable treating newborns all the way up to however old you can get. I fix broken collarbones and I do shoulder replacements and shoulder arthroscopy. And then you can also I do elbow arthroscopy, wrist arthroscopy, finger arthroscopy, and then any kind of like nerve injury, tendon injuries, again from the shoulder basically to the fingers. Because part of my training was pediatric, like I did see, congenital abnormalities. So if you're born with too many fingers, not enough fingers, missing parts of the hand. I mean, we see a lot of the high school and college athletes who get, as you'd imagine, like broken fingers playing football, a lot of shoulder injuries from lots of years of surfing, and then I do see a fair amount of like golf and tennis elbow too, just because it's sunny 300 something days a year and everybody's playing sports. What I always tell patients is that I treat them like a family member and I try to convince them that I'm not trying to sell them anything. And I try to lay stuff out like that for patients to say like, this is the thing that needs to be fixed, or this is the thing that you could fix, or you can watch it and it'll probably be fine and you got another 10,000 miles. Having surgery is not the answer to a lot of stuff. And even when it is, the recovery is difficult. It's a ton of rehab, and anything that we can make you better without operating is going to probably be better off long term. One of the best parts about working at Ventura Orthopedics is that it's like a small, it's a big group in the sense that there's 20 partners, but every office is like kind of a family vibe, and we've had a lot of the same front desk staff, medical assistants, x-ray techs since I started. They know who I am, I know their names. It's really nice sort of family feel at the office, which is fun. Seeing patients is sort of work wherever you go, but it has definitely a different vibe than a lot of the university places I've trained and bigger hospitals where you're sort of just a face or just an employee. It's myself and my wife. We live up towards Ojai, so we have some outdoor space and enjoy that a lot. The best part about being in Ventura, I think, is, the weather's amazing. I surf, several times a week. Similar to growing up, I try to do as much as I can outside. So I play some men's league lacrosse and some ultimate frisbee and all kinds of stuff that I can do anytime I can get outside and not have to go to the gym. It's nice.